Hey guys, it's Channel Name, and welcome back to the channel. Today we're diving into the world of orthopedics, specifically fractures. Whether you're a seasoned athlete or just someone who wants to be more informed about their health, understanding fractures is crucial. We'll be breaking down the different types of fractures from simple to complex and discussing their unique characteristics. We'll also cover the common symptoms of a fracture so you can recognize when to seek medical attention. Remember, early diagnosis and treatment are key to a smooth recovery. So if you're ready to become fracture fluent, hit that subscribe button and let's get started. First up, we have the simple fracture, also known as a closed fracture. Now, don't let the name fool you. A broken bone is never simple. In this type of fracture, the bone cracks or breaks but doesn't pierce the skin. Imagine dropping something heavy on your toe, ouch, right? That's the kind of impact that can cause a simple fracture. Even though the skin remains intact, a simple fracture can still be quite painful and require proper medical care. We're talking about things like immobilization with a cast or splint, pain management, and of course time for the bone to heal properly. Remember, every fracture is unique, and treatment will always depend on the severity and location of the break. Next, we're moving on to compound fractures, which are a bit more serious. Unlike simple fractures, compound fractures involve the broken bone piercing through the skin. As you can imagine, this open wound introduces a higher risk of infection. Think about it. Bacteria from the outside world now have a direct pathway to the inside of your body. Treatment for compound fractures often involves surgery to clean the wound thoroughly and set the bone back in place. Antibiotics are also crucial to combat potential infections. These types of fractures are often caused by high-impact injuries, like car accidents or falls from significant heights. Now, let's talk about fracture patterns. First up, we have the transverse fracture, which is essentially a straight break across the bone. Imagine a twig snapping cleanly in half. That's a transverse fracture. These fractures can occur from direct blows to the bone, and the severity can range from a hairline crack to a complete break. Treatment for transverse fractures, like other types, depends on the severity and location. In some cases, a cast or splint might be sufficient, while others may require surgery to stabilize the bone. Remember, early diagnosis and proper treatment are key for optimal healing. Next up is the oblique fracture, which features a diagonal break across the bone. Think of it like slicing a baguette on an angle. That's the general idea. Oblique fractures often occur from a sharp, angled force applied to the bone, like tripping and falling at an awkward angle. Treatment for oblique fractures can be a bit more complex than transverse fractures because the angled break can sometimes cause the bone fragments to move out of alignment. In some cases, surgery might be necessary to realign the bone fragments and stabilize them with plates, screws, or rods. Now let's talk about spiral fractures. As the name suggests, these fractures have a spiral or twisting pattern around the bone. Imagine wringing out a wet towel. That twisting motion is similar to the force that can cause a spiral fracture. These types of fractures are often seen in athletes, particularly those involved in sports with a lot of twisting motions like skiing or soccer. Treatment for spiral fractures, again, depends on the severity and location. In some cases, a cast or splint might be enough, but more severe spiral fractures might require surgery to realign and stabilize the bone. Let's talk about comminuted fractures. These are more complex fractures where the bone is shattered into 3 or more pieces. Think of it like dropping a glass on a hard surface. It shatters into multiple fragments. Comminuted fractures usually occur from high-impact injuries like car accidents or falls from heights. Treatment for comminuted fractures is often more complex due to the multiple bone fragments. Surgery is usually required to piece the bone fragments back together, and this might involve using plates, screws, rods, or even bone grafts. Now, let's shift gears and talk about a type of fracture that's more common in children, the greenstick fracture. Think about a young green tree branch. It's flexible and doesn't break easily, right? The same goes for children's bones. In a greenstick fracture, the bone bends and cracks but doesn't break completely. It's like partially breaking a twig. It's still connected on one side. These fractures are more common in children because their bones are more pliable and haven't fully hardened yet. Treatment for greenstick fractures is usually non-surgical, often involving a cast or splint to immobilize the bone and allow it to heal. Let's talk about impacted fractures. These occur when one fragment of bone is driven into another fragment. Imagine a telescope collapsing. That's kind of what happens in an impacted fracture. This type of fracture often results from a compressive force, like falling from a height and landing on your feet or hands. Treatment for impacted fractures depends on the severity and location. In some cases, a cast or splint might be enough, but often surgery is needed to elevate the impacted bone fragments and stabilize them. Let's talk about stress fractures. These are small hairline cracks in the bone that develop over time from repetitive stress or overuse. Imagine bending a paperclip back and forth repeatedly. Eventually, it will weaken and break. That's similar to what happens in a stress fracture. These fractures are common in athletes, especially runners, dancers, and gymnasts, who repeatedly stress their bones. Treatment for stress fractures typically involves rest, ice, compression, and elevation, also known as RICE. In some cases, a walking boot or crutches might be recommended to reduce stress on the affected bone. Finally, let's discuss pathological fractures. These are fractures that occur in bones that are already weakened by an underlying medical condition like osteoporosis, cancer, or infection. Imagine a twig that's been eaten away by termites. It's much easier to break, right? That's similar to what happens in a pathological fracture. Treatment for pathological fractures focuses on addressing the underlying condition as well as stabilizing the fracture itself. This might involve medications, surgery, or other therapies. It's important to note that pathological fractures can occur even with minimal trauma, highlighting the importance of addressing underlying health conditions. That wraps up our comprehensive guide to fractures. I hope this video has given you a better understanding of the different types, symptoms, and treatment options available. Remember, early detection and treatment are key for optimal healing. So if you suspect you or someone you know has a fracture, please seek medical attention immediately. Don't forget to give this video a thumbs up if you found it helpful, and subscribe to the channel for more informative videos on health and wellness. Stay safe and take care of your bones. Thank you for watching our guide on fractures. Remember, if you suspect a fracture, seek medical attention immediately. Stay safe and take care of your bones.